Hi, so today I'll be discussing with you a common myth surrounding the causes and the treatments of schizophrenia. The topic, although not widely used anymore, is still supported by doctors in the psychiatric field to this day. For example, Dr. Peter Breggin is a leading psychiatrist whose scientific and educational work have provided the foundation for modern criticisms of psychiatric drugs. On his YouTube channel, Breggin clearly states, "We have no evidence that any routine psychiatric problem from anxiety, depression, and even schizophrenia have anything to do with the biochemical imbalance." The issue here is that Breggin is completely disregarding one of the most prominent risk factors associated with schizophrenia, the biochemical aspect. Although we don't know much about the true causes of schizophrenia, what we know is this. Schizophrenia is a neurological disease that encompasses a wide variety of symptoms such as hallucinations, delusions, social isolation, and a wide variety of other symptoms as well. There is supported evidence that states that chemicals such as dopamine play a large role in the onset of schizophrenia. Whether it's the sole reason or attributes to the onset is unknown, but it's highly supported that this imbalance has a large impact on psychosis of a patient. In 2017, a collective model was released that explained that many extenuating circumstances all impact the regulation of dopamine, causing the onset of psychosis. Similarly, in 2018, a meta-analysis of 108 MRI scans of schizophrenic patients compared variability in regional brain structures and found increased activation in regions of the brain associated with the regulation of dopamine. So as I said earlier, there's no single cause to schizophrenia. There are many external factors that have been attributed to the cause of this neurological disorder. The issue with Breggin's ideologies is that he solely focuses on debunking the biochemical aspects and doesn't attribute schizophrenia to any other risk factors. A study conducted in 2017 investigated the long-term effects of childhood trauma exposure on social brain functions in adults who were diagnosed with schizophrenia. They concluded that there was an increased activation in areas of the brain associated with cognition when exposed to greater levels of childhood trauma, indicated that societal aspects play a large role in the onset of the disease. Another study in 2017 found that 90% of their patients with schizophrenia had deficits in greater than one cognitive domain. So, to conclude, I wanted to point out some things that Breggin stated that are actually in fact correct. He indicates that the biochemical aspect only leads to the onset of psychosis in schizophrenic patient. His theory is highly supported with evidence from the study conducted in 2009 that worked to explain the final version of the dopamine hypothesis. They offered that the dopamine imbalance in the brain produces symptoms of schizophrenia such as psychosis, but it's not necessarily the cause. So although it's not known that the biochemical imbalance plays a large role in many neurological disorders, it's still widely unknown what the true causes are.